everyone. My name is Taylor Grimm. I am the grants manager for the KCOM Primary Care Training and Enhancement Grant. Today's presentation and the rest of National Primary Care Week this week, Monday through Friday, is brought to you as a part of that grant. Dr. Wilson and Dr. Trish Sexton are the directors of that grant. We have activities every day at noon, of course, so Thursday and Friday we have other presentations in this room, so please be sure to join us. If you didn't RSVP for those events, that's totally fine, just come on by. We also want to make sure that everyone completed your evaluations. You have those in front of you. It's best if you complete those with a number 2 pencil, which is why we've given you a pencil, but if you don't have one for any reason, there's extras over there. So today we have a panel here to tell you a little bit more about the National Health Service Corps. The National Health Service Corps is a division of the Health Resources and Services Administration, and its goal is to strengthen and grow the primary care workforce by awarding scholarships and loan repayments to primary care providers in eligible disciplines. The members of our panel, they vary in their experience with the National Health Service Corps, and they'll give you a glimpse into their own experiences today. So I'll kind of introduce our panel here. First we have Dr. Wilson. Just a second. She's the Dean of Kirksville College of Osteopathic Medicine. And the next we have, oh, that was just... Duh. And then to her right, we have Francesca Cook. She's a physician assistant at the Northeast Missouri Health Council. Next, we have Dr. Brent Speak. He's an obstetrics and gynecology physician at Northeast Missouri Health Council, GYN Specialty Group. And then to our right, furthest right, we have Joni Adamson. She's the manager of Recruitment and Workforce Development at the Missouri Primary Care Association. So if everyone could welcome our panel members.
All right, thank you, Taylor, and thanks for being here. Hopefully you'll learn a little today about the National Health Service Corps, maybe pique your interest. How many in here are DO students? How many are dental? Do we have any dental in? No dental today. You know, as Taylor explained, the National Health Service Corps is a program put on by HRSA to really help place healthcare providers in the areas of greatest need, and primarily underserved areas. All those, they can be rural, urban, frontier, you know, a variety of settings. And they can include everything from community health clinics to private practices to other, you know, designees that meet the criteria as an underserved population. I'd like to just kind of give you a little brief snapshot of what some of the choices are with the National Health Service Corps. They currently have 3 kind of options, all right? And I know when Joni speaks, she'll be able to give you some more details here. The first is the scholarship program, the National Health Service Corps Scholarship Program, which you can apply for, you know, any year that you're here in medical school. It is one that pays for your tuitions and fees and also gives you a monthly stipend to live on. You have to give a minimum of 2 years, and it's a 1-for-1 payback when you were to ultimately finish your residency program. Now, all the programs in the National Health Service Corps are geared towards primary care. Their definition of primary care is family medicine, general internal medicine, general pediatrics, geriatrics, psychiatry, and am I missing one, Joni? OB-GYN. I'm so sorry, Dr. Speak. I knew there was one more. OB. So, you know, if you have an interest in one of those fields, it's a great way to, you know, fund your time through school by applying for the scholarship. The only downside to the scholarship program is, you know, every year there's a lot of applicants and a few number are awarded. KCOM historically over the last decade or so, I would say, usually gets 1 or 2 scholars per year, but it's very competitive just by the sheer numbers that apply for the scholarship and the number of awards they give. So scholarship is kind of option 1. Option 2 is what's called the Students to Service program, which basically occurs in your 4th year medical school. You make the decision to apply for it then, and you would then do your service once you finished your primary care specialty residency and get money to pay back on your loans, and I believe it's a 3-year minimum requirement. So that's kind of option 2. Maybe you don't know you want to do primary care as a 1st or 2nd year student. Maybe, certainly you've discerned that by year 4, and you think this will be a wonderful option to help lower your student debt. And then the last option is the loan repayment program, and that would happen somewhere down the road, after residency when you're in practice, where you can apply for the loan repayment program and again receive funds that would pay back towards student loans during your time of service on the loan repayment program. So those are kind of generally the 3 options here, and I think the panel, everyone has a little different experience in what they did. I just always encourage students that, if you go into primary care, whether you commit now or later, this is a tremendous option. It really is. If you're going to do it, why not, get funds to pay down loans, and there's such a wide variety of choices of where or how you practice. It's really kind of almost sky's the limit in terms of the opportunities out there. So certainly would encourage you to look at this, whatever stage you might be discerning your specialty choice. I was a scholar. I had the scholarship program and ended up, serving my time in a very small rural community in southeastern Kansas as the only physician within a 90-mile radius. I took my own x-rays, I developed my own x-rays, and I read my own x-rays. That was back in the days when you had to hand dip them too. Wow. So I may glow in the dark just a slight bit. But, it was a wonderful experience, and certainly wouldn't have traded that experience for anything, and was very happy to be, mostly debt-free by the end of my service. So I'll let Francesca tell her story.
So as Taylor said, I'm a PA, and I graduated back in 2015, and my experience is with the NHSC loan repayment. So I was lucky enough, I'm from this area, and I have a family of 4 daughters and a husband that is in a job he doesn't want to leave here in Kirksville, and so I was lucky enough to find out that the Health Council here in town qualified for the repayment program, and so I applied right out of school in April, and it is actually the following year. So I graduated in May, and then the following April I could apply for the repayment. And then the money came into my account about September, and it's different amounts. I think for MDDO, it's a little bit different. For PA, it was $50,000 with a 2-year commitment, and that's full-time commitment. There are part-time options, and it's really been a very easy process. The application process is no more complicated, no less complicated than anything you guys are already used to. So really, it's been very simple. They check in about every quarter with hours, and my place of employment does verify those hours, so it's kind of an email back and forth. I think if those hours don't match, it becomes quite an issue, but so I'd make sure that you kind of get together and know that your hours are accurate. But other than that, it's been a great experience. So, and I can reapply after the 2 years, and it's a little bit less each time you reapply, but every 2 years I can reapply, so.
Like Taylor said, my name is Dr. Brent Speak. I went through the loan repayment as well. Starting medical school, I did give some consideration to apply for the scholars program. However, I wasn't sure what I wanted to do. Even into my 4th year after I chose obstetrics and gynecology, I wasn't sure whether or not I wanted to do general OB versus go into maternal fetal medicine. And so at the time, those options, I wanted to leave my specialty options on the table. So I I did not do application earlier. However, at the point, when I ended residency and I made the decision to come back to Kirksville, I'm actually went to KCOM, born and raised in Kirksville. I grew up like 8 blocks that way. So, and so I made the
Is there a
decision.
historic site there? Is it like? have a
No,
sign?
actually, the house that I grew up in has been torn down, and the people who used to own it put a large concrete monument there, and it's kind of weird. So if you
In
look-
your honor, of course.
No, not mine. And so if you drive down this road and you see this empty lot with a grave marker there, and it's the only that's where I grew up. So that's a little beside the point. But and so after I moved back to town, you're in the process of trying to pay back loans. And then I realized, that I also, like Francesca, worked for the Northeast Missouri Health Council, which is a federally qualified health center, that this was an option for me. And so I did apply and was accepted into the loan repayment program. And so even if you are you still want to leave your specialty options open, which I did, and ultimately it chose what they consider a primary care specialty. It is still an option, so always kind of keep that in the back of your mind.
Thank you. Did you want to speak any to, I know, so after your 2 years, did you do a continuation?
Yes,
or-
yeah, I've been in the loan repayment program. You'd have to ask my wife. She would probably know better. Really, she should be here instead of me, but no. I think now for 4 years, and so we went through the first the initial period, and then reapplied for continuation. And so yeah, I'm in the process of I'm in the continuation period, and like I said, born and raised here. I have zero desire to leave here, so I anticipate that as long as HRSA funds
keep
exist, HRSA funds exist and my loans exist, which I have Dr. Wilson, she made sure the tuition's elevated, so that'll be
No,
here
I
for-
don't set tuition. Let's make that clear. The university sets tuition.
That's what you get for slighting my
have
specialty.
no-
So I chose not to talk about the length of your broad experience over time, so.
Too funny. I better interject here before I
You
have
better
to
jump
get
in.
between these two, right? So hello, I'm Joni. And so my role in this is I actually work for the Missouri Primary Care Association. And so we are a nonprofit association that represents all of Missouri's federally qualified health centers. So as these two folks reiterated, the place that they work is one of our members. And all of the sites that we represent qualify for these 3 programs that Dr. Wilson went over. And so in terms of National Service Corps, she talked a little bit about how it could be community-based clinics, it could be private practice, it could be sometimes even hospital-based. So there's a variety of organizations that qualify. But the main requirements are it has to be in an underserved area. And as also Dr. Wilson pointed out, sometimes that's a rural area and sometimes it's an urban area. People may not realize that, in places such as Kansas City and St. Louis, so you can have every component of the healthcare delivery system, but yet you still have places that are underserved and people that have limited access or sometimes no access and barriers to care. So there are clinics even in those areas that qualify for programs such as the National Service Corps Scholarship, Students to Service, the Loan Repayment, and the Loan Repayment Program. A couple things to touch on. I just usually mention, in my role, I do a lot of what we call loosely career counseling. So we do a lot of CV review workshops. We talk to a lot of students. And then we also work to make opportunities available to students if they're interested in working and staying in Missouri. We happen to know great places that they can go to work. So, and we always mention the benefits of the loan repayment. So that's kind of my role in being with the panel, kind of the technical assistance perspective. So in terms of the applications for these programs, I'll just go over a lot of the questions that we kind of get, some of the myths of the programs, and then I'll ask these folks if they can also chime in with their experiences. So people ask about the application cycles. They do vary. If you happen to get on the websites for these programs, you'll notice there's no specific date because they do change. They're usually around the same time of the year, but they're not always the exact same dates. So the best thing to do, for instance, if you are interested in the scholarship program, is to get on the website, and then you can sign up to be notified when the application cycle opens, and you'll get an email to let you know. Also, if you follow them on social media sites, they always post when the applications open as well. So even though all of these programs always receive more applications and they have the dollars to fund, please don't let that stop you from applying, because if you talk to any of these scholars, for instance, focusing on that program, for instance, Dr. Wilson, she would have never gotten the program if she didn't apply. So, you know, kind of what Missouri Lottery logos or slogan says, you can't win if you don't play, right? So just look at it that way. And many people have applied several times in a row, and some of them, they saw that come to fruition, and then others applied and never got the scholarship program, but they had tried in their last year of training and they received student service, or maybe they didn't get it then they went into loan repayment. So while it's a little bit disheartening to think it's very competitive, I also see it as a good opportunity in that we have 3 programs that you could potentially kind of meet you where you're at, whether you don't really know your specialty and you wait until you're done with training and you're working for a site that qualifies, or if you know what your specialty is and you're going to go after these programs. So another question that we get asked often in particular to these programs are, you know, does the federal government place you somewhere? And I'll let Dr. Wilson talk a little bit about that. But it was different a few years ago, but now they do not place you. You know, I kind of use the analogy of the big claw game where you go in and you pick a prize and they put you down somewhere. That's not the way the program works any longer. You are able to find your own jobs. You're able to do your own interviewing. You're able to pick those things. The only exception to that would be is if for some reason you don't take upon yourself to find your own job, they will tell you where you have to report before you're deemed non-compliant, which you do not want to be in a non-compliant situation. And I don't feel that would ever happen with the folks here, but that would be an extreme case. So someone tells you the government made them go to a site, maybe ask a few more questions. But I think a few years ago it was a little different, if that they kind of limited maybe your options of where you could go. And
Yeah, back in the day,
Yeah.
they did limit, you know, we were basically assigned a region of the country, which
Right.
usually was up to, I think for my region, it was like 5 states, and they had a list that we could choose from, and then we had to match. But as Joni said, it's
Yeah.
completely flexible these days, as long as you meet the criteria for the HPSA score, which is a health professions shortage area score
Right.
that is deemed by the government. You know, you have the same options you would if you're out there on your own trying to either set up a private practice or, you know, work for a hospital system or some other kind of healthcare system. You know, all the same options are out there, and you would do the same kind of, you know, looking at all those and kind of matching and seeing who wants you and who you want.
the site does have to do an application process, and they do have things the site has to meet. But again, you have the flexibility to choose, you know, where you want to be and what you want to do. And, you know, if you happen to be in a location that doesn't have shortage designations like the HPSA, you know, those would be limitations because the site does have to meet certain requirements. But again, it's not like a military assignment where they tell you where you have to go and report to. So I don't know, with you guys' experience, I know you mentioned you started working and then you had to wait till the next cycle. So sometimes that happens. It's pretty common that would happen for loan repayment. It could be that when, an example may be, you'll come out and complete residency more than likely in June. And so you'll go to work shortly thereafter. And at that time, it's possible that the loan repayment application cycle is not open. And so you'd have to wait for that, catch that next cycle, which would be, unless they change the kind of the time frame by which these programs open, it would probably be in the spring of that next year. So as you go into practice and you find out the place qualifies for loan repayment and you're eligible, in terms of your planning and preparing, just know that it's not a given, and you do have to wait for that cycle to open. So you would need to be prepared to, you know, meet your obligations and everything until the program opens, and then until the cycle is closed, applications are reviewed, and so forth. So all wonderful programs. I am a big cheerleader for these programs, but it's important that as we tell you this stuff, that you understand it's not like you start work on a Monday and then your loan repayment money comes on that Friday. So I just like to make that clear too.
And as Dr. Speak mentioned, there's potential for it going on for quite some time. I believe Dr. Herbst may be in
Right.
his 7th year.
So
Yeah, he's a
maybe
dentist
even, yeah,
locally.
maybe even, yeah.
So, yeah.
And it does reduce a little bit each year. So after your first 2 years of full-time, then you have the continuation option. And then the continuation is actually on a year-for-year basis. So that's kind of something that's neat about that. It doesn't lock you down again for another 2 years. The amount does reduce a little after each year. But kind of what I heard Dr. Speak say, if it's okay that I speak for you, Dr. Speak, is that, sorry, no pun intended, that just came out, I'm sorry. Is that he's enjoying what he's doing. He's not planning on making any changes anytime soon. Why not continue on and go on with the program? And so I think that's another wonderful retention component for the community and the organization, so. You guys know, can you speak, do you know other providers that are?
Yeah, there's another nurse practitioner over in Myland, I believe,
Okay.
Amanda Wilfred. I think she's in the program also.
Okay.
And I know we have a new nurse practitioner that plans on applying, so. And it will extend towards like a bachelor's, part of your bachelor's degree too, so that's something to keep in mind. If you have something left over, it does qualify also, so.
I know some years we've had students on the panel, and I'm not sure they probably weren't available. I know Matt Tilton, he's a 4th year.
Yeah.
I'm sure he's more than happy to talk to
Yeah.
anybody. He's a scholar. His site is here in Kirksville, but he's probably out on audition rotations right now. But I know he'd be more than happy to talk to you. And then Yoke, he 3rd year now, right? So I'm not sure where he is, but he also is a scholar, and they've always indicated great openness to discussing with another student about kind of the process. And I know they've always strongly encouraged, again, even though the odds are maybe not, too promising, that, to apply for it, because you never know.
Did, when both of you applied, were you approved your first time you applied, or did you have to go through it twice?
First time.
Wow,
Yeah.
okay, good. Has anyone here applied for the scholarship program? I won't embarrass you, I'm just curious. You have? Okay. Did you receive feedback, or it was just?
No, it was just an email.
Okay, I didn't know if they would provide reasons why, or, okay.
Yeah, no, they don't. I
Okay.
get asked that a lot. What are they looking for? And,
Yeah.
how do I know? With that many applying, like there's over 2,000
Yeah.
applicants, I think you can imagine, it's kind of like medical school applications. They
Yeah.
may start looking kind of similar after a while, in terms of your, kind of the themes. But, definitely your personal story and, where you want to be, eventually, and the kind of service you want to give, I think would be a compelling way to approach that. But, I don't think there's a magic formula at the end of the day.
I've actually reviewed scholar applications. This last cycle, I reviewed some of them, and they mask them. You can't tell who's who or what's what. But just to give you some insight, the applications are broken up. So the blanks that you fill in on the actual application is sent to one spot, and then they break all your essays off and send them to several different reviewers, and they get scored. And then we have a rubric. And I always heard this, but I never actually was chosen to review applications, so it's kind of exciting. But Dr. Wilson's exactly right. You get a rubric kind of that you have to go by and score these things on, and it's based on, a lot of it is your story. Why did you, because obviously if you're applying for the scholarship, you're committed to primary care, so why did you choose primary care? Why are you committed to the underserved? So any experience that you have, in the altruistic nature, much like applying to this school, for instance, I think that's why you may say, oh, we only have 1 or 2, but that's actually really good to have a
really
couple
good.
scholars.
Yeah,
So
most schools don't have.
you're right. Yeah.
that
So
record.
So it's always refreshing when I come up here and are able to meet scholars. So those types of things they look at. They want to really know that you're going to be able to fulfill your obligation in an underserved area. So, you know, and a lot of that fuels from your personal stories and things that you've been exposed to. And then also that is, you know, if things continue to go well, you want to stay and you want to be committed. This is a lifelong choice that you're making. And if those things, you know, don't lie, obviously, if those things fit you well and that's what you want to do, then I encourage you to practice jotting that down in your essay. And those things would definitely help. Just some pointers, but again, you know, you've got several people reviewing it and scores coming in, and so that's how it's hard to really tell what the algorithm and what it is. But I always say to folks in my CV workshops, it's kind of feels awkward for us to toot our own horn or for us to talk about ourselves. But in situations such as this, it's very appropriate that you know, share those stories and talk about them. Because people don't know you and they don't know your intentions unless you communicate that. So apply next year. Don't stop applying.
And if you're interested in the Student to Service program, it's relatively new. I think it's only been around like maybe 4 years now.
Handful of years, yeah.
I have a contact for that to a grad that did a family medicine residency in Michigan and ended up staying in Michigan, I believe, and she'd be willing, certainly, I think, to talk about that too. Do you have questions for us?
Yes.
Mm-hmm.
Good.
Yeah, because unless it's, you know, med peds or general peds, it wouldn't qualify as of today, the way they define it. So, yeah.
Do they often review which specialties they consider primary care?
Well, I mean, they added it, psych did not used to be on there, nor geriatrics. So, yeah, I don't know that they have a formal way that they review that, but, you know, they consider it. And general surgery's kind of popped up as a question off and on, but I don't know that it's ever been designated. So it's potentially possible, I guess.
The other specialties have been stable, at least since I've been in school. When I was looking at it when I was in school, they didn't have psych or geriatrics, but everything else has been stable.
Talk about your region, and you were placed within your region. What are those regions, or how are they changed?
Ye-
You get to choose like what region, I'm interested in this region, but I have to choose that.
They got rid of the regional system, so
Yeah.
U.S. states and territories too, I think,
Yeah,
maybe.
there are some
So,
U.S. territories that qualify as well.
yeah, there are your choices.
They do ask you closer to your completion of training, they ask you if you have a general idea of where you would like to be. And usually by then you kind of know. And so they will assign you HRSA, which is the governing body for, it's a department that the National Health Service Corps falls within. They have regional staff across the country, and so they would assign you to someone in that region to help you with your job hunt or to help you arrange things. But that's once you've said, you know, this is where I want to go. And again, it's not to dictate where you will work, it's just to give you kind of a local person in that area of so many states to work with, if that makes sense. But if you are open to the whole country, then they would probably just assign you to a contact, and then you could just work the whole country for your interviewing and making sure it qualifies. And so, does that help?
How often does a site like lose, I guess it's qualifications?
So they do have to go, sites do have to go through recertification, and there's a cycle that they're on, and honestly, that changed recently. So I want to say, and some of it has been suspended because of new things the program is looking into. It's either, I think it's a 3-year cycle, but it could be up to 6. But the sites are notified usually a year in advance, And so they have time to go through and keep things up to compliance and so forth. But if something were to happen and the National Health Service Corps found out that a site was in non-compliance, the Corps would step in then and, I guess, try to do, for lack of better words, intervention and help them get back up to compliance. So. But if you're looking at a site and it is not selected currently, say you've picked ABC Clinic and they're not in what's called an approved site, they do once a year, they do site application processes. And so the site could apply that next application cycle to be looked at. If you go to work for a site like a federally qualified health center and they're located all over the country, those sites automatically qualify. Then you would just need to make sure that the HPSA score meets. So it's not to ramble and make you confused, but there's lots of different nuances with it. It's not hard, but whenever you reach that point, it'll make sense, so.
Someone had mentioned that they try to make sure you get enough hours. Can you speak more to that and what the requirements are to maintain your?
I can't tell you exact. I want to say it's a full-time hour. I want to say it's
32.
around 32 hours a
32,
week.
32
that you have to
contact
average, right?
patient contact.
Patient contact hours, correct? Right.
It is a little different for obstetrics because I
Yeah.
think they break out clinic work and hospital work. And so I have to have a certain, and off the top of my head, I know I meet it, but I don't remember what the precise hours are. But they will break out, and so for some more hospital-based specialties, they will have generally some requirement, hours requirement in the clinic. However, that is lower than what hers is because she's expected to be in the clinic the whole time. And then I have a certain amount of time that I'm allowed essentially to be in the hospital for the purposes of hours.
It's not hard to meet. And then I wanted to say something. You go ahead.
No, go ahead.
I was just going to speak to the sites that don't already qualify. I had a potential job opportunity at a site that wasn't, and they were willing to apply. So if you have a place that you really would like to work, you think maybe they might qualify, usually they're willing to apply, so.
Had you guys
Other
heard of these
questions?
programs before today? Had you? No? Okay, all right.
Yeah, again, I think the take-home message is, if at any point along the way you think you're going to end up in one of these primary care areas, definitely explore it. It is a worthwhile and really, because the choices are so broad and so, personally kind of, you can design your own personal path. There's no reason not to, okay? It really is a wonderful way to pay back student debt and to have good, I think the other part maybe we haven't talked about today, and I know we were talking about that yesterday just a little bit, is the real reward of serving these populations. I mean, these are underserved populations, so these are patients that many of them, for a variety of reasons, otherwise wouldn't have access to care, wouldn't be able to get the care and the services that we're able to provide, and that's tremendously rewarding.
So I was talking to a physician about my desire to practice in a rural setting. And according to his opinion, he suggested that initially once I'm done with my residency, to practice in an urban setting and to get exposed to resources and high patient volume and then go into a rural setting. I wanted to know your guys' thought about it.
I could see the thoughts going through your head, Dr. Speak.
Yeah, that's interesting.
We're all biting our tongues.
No, well, I don't know if, there's certainly a difference in practicing in a high-resource setting versus a rural setting. For instance, I did my residency at a tertiary care hospital where we had I'm OB-GYN, right? So we had easy access to reproductive endocrinology, MFM, gynecology. We had a level 3 NICU, and so we had everything that we needed there. And I've always thought one of the hardest things that I ever had to learn coming here, and this is to Kirksville, was when do I ever transfer somebody? Because working in a tertiary care facility, we never transferred anybody. And so I'm sitting here on the floor, so you have somebody who's in preterm labor in the closest hospital with a neonatal unit is 90 miles away, and you certainly don't want to separate the mom and the baby, but you don't want the patient to deliver in the back of the ambulance. Okay, and so there are practical issues that you have to consider when you're moving from a highly resource center to a non-resource center. I don't know if it makes sense necessarily to say, oh, you should practice here for 4 years or whatever as a family doc or general peds or whatever, and then move out to a rural setting. I think that that would be difficult to do. And I don't know if you would benefit any from from the educational process. I mean, when I came here, I had to learn different things because I didn't have the backdrop of multiple specialists behind me. I don't know if I would have been any better at it, and potentially it would have been more difficult if I had established a practice in a high-resource setting prior. I'm not sure I agree with that advice.
I agree. I'm not sure I would agree with that advice either. You know, I did my postgraduate training at a 600-bed urban hospital with every, thing known to man available, and went to this town of 800 in rural Kansas, where in the day I arrived, I became the medical director for the nursing home. I became county coroner. I became the jail doc for the county jail. That was an experience. And I, like I said, I developed it and read my own x-rays. It was an all-purpose thing, and I can't imagine learning more through that experience and in process. And I don't know. Go where you feel drawn to go.
I'm not a clinician by background or training, obviously, but I sure do work with a bunch of them, and some of the things they have shared with me, and this is a direct quote from someone I was working with. They said, if you really want to practice your craft, and if you really want to be all you can be in terms of, just as you were mentioning, having to learn a lot of things, they were of the personal opinion that doing it in a rural area was where to do it. Now, it doesn't mean that you're all things to all people, but they did not have to limit themselves. Sometimes, depending on where you go, if you are family medicine, there are some places where just by nature of the way their clinic is set up, you really don't see too many kids. You don't have the option to do prenatal, those things. But usually in a rural area, you kind of see the whole gamut, and it really is getting to practice that and put it into the full perspective. So again, you have to choose the best fit that's going to be for you, and then whatever those characteristics are, if you have family considerations, choose the best fit there, obviously. But, gather enough information to make a well-informed decision for sure.
Coming back to that point, I think I'm more strongly against it than I was initially. I remember
Tell
when I
us
was
how you really feel, Dr. Speak.
I remember when I was studying for oral boards, and somebody is one of the, you get all kinds of stuff in the mail, you get this oral boards course or something like that. And there was someone who wrote an oral boards book, and she was a military physician, and she, as an aside, made a comment that, and this was at obstetrics, that the oral board pass rate for obstetric military physicians was like very high, like high 90s. And her point was that they had to learn to adapt with the resources that they had. And so I think even from an educational standpoint, I would, and there's obviously nothing wrong with practicing in a high-resource urban setting or whatever, but if you're going to do that, I think that there is a wealth of educational opportunities coming out immediately, because a lot of times, I think that in your practice, you kind of get in a groove, and you kind of get, you're not lazy, you don't get lazy, but you get bogged down with the ins and outs of taking care of a practice. And while you're a resident, you've gotten yourself revved up to learn, and you've been through this process so far, or for so often. And I think coming out and making the transition actually, I think, is probably easier just coming straight out of residency.
When I think of things too, just in terms of human nature, you know, if you're going somewhere and you're settling for 4 years, sometimes it's hard to uproot unless you're going back to what home is, or going back for ailing parents, or for different reasons. So, the longer you stay somewhere, the longer it is to leave typically, with human nature. So I think of those things too.
Any other questions? I know we would all be, willing anytime if you had questions or just wanted to talk and visit a little bit more, we can get you to resources.
Sure.
As Joni mentioned, I think the website is a good resource to go to. Their website's pretty good and has a lot of, the frequently asked questions section. It answers, I think, a lot of what you might have, but we're more than happy to be available anytime.
Also, keep in mind that when that day comes and you are practicing somewhere, if it's loan repayment, if it's scholar, students to service, whatever it is, make sure that an employer, isn't trying to include that as part of your personal benefits package. So you'll receive your compensation, your benefits, your paid time off, holidays, whatever they use for, your insurance plans and retirement. All of that is what it is. And so these programs are on top of those things. So just keep that in mind, that you're not working, unless you go to an entity that is, you're not working for the federal government. You don't have a contract with them for employment. You have a contract to fulfill an obligation, but you're working with your employer. Sometimes that gets a little mumbled up and jumbled up in us explaining that, and we take for granted that you know that. But just recognize you have a requirement, if you're for a scholar, to fulfill, but you still get to pick your choice, and then you're an employee of that place. And so you qualify. No one should slide you because you're a scholar. They shouldn't say, oh, Dr. Wilson, you're a scholar, so we're going to pay you half, and you don't qualify for vacation time. Run.
So we used to do it.
So years ago, again, that's an old myth. Sometimes that happened, and so it's not like that anymore. People can say, just as you mentioned, we qualify for loan repayment, and that should hopefully play a factor in your decision. And if you're looking at two sites, one qualifies, one doesn't, but will apply, well, this site already meets. So again, just gathering it all to make a good fit and a well-informed decision. I just like to toss that out there.
Great. Thank you for being here. We appreciate it.
Good luck, guys.